Testing, 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 testing. One, two, three. If you can hear me, you can come back around. Testing, testing. One, two, three.
Ready? Keep this off. Good evening, folks. We're going to go ahead and get started with today's meeting. All right, as we call the meeting to order, first and foremost, I just want to say welcome to our opioid settlement annual community meeting. So grateful to have all of you guys with us for this evening for um, a time of uh, discussion and conversation just around our opioid settlement dollars. And so many of you guys hopefully have already received a lot of the emails and the agenda. So hopefully you have seen this right here. So essentially what we're going to do today, slightly different from last year. If you did have the opportunity to join us last year, if you did not, this is going to be very discussion heavy. We will have an opening of just the opioid settlement funds review. So we'll walk through essentially what Durham County is receiving in terms of the opioid settlement. And then we'll walk through just a few slides with that. Afterwards, we will have a couple of discussions with panelists. Our panelists will be those individuals who are recipients for the opioid settlement dollars for this year. So they'll be able to walk through a lot of the impacts and a lot of the great things that they've been doing with the funds this year. But afterwards, there'll be an opportunity for you guys to make comments, ask questions, all the questions that you want within reason, within time, because we do have to be out of here by 7 o'clock. So we will make sure that we are respecting the time. After that, we will have the Opioid Settlement Advisory Committee co-chairs. They will be with us as well. This year, they made the FY27 funding recommendations. So they will be sharing those recommendations, and then there will also be time for discussion as well. And that will be it. So once again, just welcome. We're glad that you guys are all here for our annual community meeting. And as we get started here, just want to just kind of ground us all in this one little statement here. And that's we're all here essentially for whatever reason you all decided to come to this meeting. I think it all really boils down is that we all care. We all care about the well-being of our Durham community. There's so many different opinions. This work has been so rewarding and also very engaging as well. But at the end of the day, I believe that we're all here for this one specific reason, and that is because we all do care about the well-being of our community. So with that being said, I'll jump into the funds overview. Oh, no, not yet. How are you going to participate? How are you going to ask questions? All right. So there's two ways that you can ask questions. You can just raise your hand, and we'll have someone come and bring a mic to you. You can ask a question that way. Or we are trying to be innovative here with technology and may or may not work, but we are going to use a QR code, which is it'll take you to a Slido. So if you guys want to, you can do that as well. And while the presentation is going on or during the panel discussion, you can actually enter your question. The question will come to someone on our team, and then we'll just go ahead and ask the question for you. You don't have to do that. That's just an option. Sometimes people have very sensitive questions, and you may or may not want to do that publicly. So you do have an option to submit that question just via the QR code. So, and if that's not your preference, then you're more than welcome to just raise your hand and just ask the question. All right. So let's jump into this. This is a very familiar slide that if you ever heard me make any presentations, you've heard me say this a million times. Durham County is set to receive $21 million over an 18-year period. $21 million. This is not to be confused with the city of Durham, who also receives opioid funds. This is the county funds that receives these funding. And so just looking at that number there, that $21 million that we receive over 18 years, as you can see that we are front loaded with most majority of the funds. Actually, if you look at the date there, we have received close to 38% of the funds already in the first few years of the opioid settlement. As you also can see just from this graph here, that the money actually tapers off over years. So the funds that we receive, it tapers off, which also speaks to one of the reasons why we're here, right? So we can figure out how do we strategically make investments that count and bring impact. Another thing here as well is that if you look at that $21 million, just do a quick little math, divided by 8, you're going to get around $1.1 million per year. $1.1 million a year. So that's our annualized number that we typically can safely use to invest into opioid use disorder, into our evidence-based strategies. Now, you may have heard us authorize funding for a little bit more than 1.1. How do we do that? So because we have not spent, and I have a slide here, we have not spent everything consistently throughout each year, we've have some capital that is unspent. That capital that's unspent has received interest income, which allowed us a little bit of room, a little bit of margin to do a little bit more this year specifically than we have in the previous years. But mind you, that margin that we had between if you look at those first few years, it's about $7.8 million. And I'll show you a slide about how much we spent. There's a large gap there. That large gap is, once again, it's working as capital that's also developing interest income that can help go towards any of our evidence-based strategies. So just kind of lingering on this a little bit so you guys can kind of, put this number in your head because it's very important. This is how much money that the opioid funds have been spent over the last 3 years. The reason why we put this slide up here, we presented it last week to the commissioners, but we wanted to do it this year because this is one of the excuse me, one of the top things that were prioritized during the survey that many of you guys completed. We had close to 130, 140 different survey responses. One of the things that you guys wanted to hear was how the opioid funds are being spent. The number one thing that we're spending our funds on is naloxone distribution with the Durham County Department of Public Health, our harm reduction team. The second largest expenditure that we have year so far is with recovery support services. And this is also being conducted by Recovery Innovations. Number 3 is going to be our post-overdose response team. So it's a Durham County Office of Emergency Services. That's going to be our third. And then our collaborative strategic planning, which is within Durham County Public Health. That actually supports the opioid settlement manager position and amongst other things. And also the SSP, or the syringe service program, which is also within our harm reduction program. And so during today's meeting, you'll be able to hear specifically from these recipients, and they'll be able to share all the wonderful things that they've been able to do this year, but also give you guys an opportunity to begin to ask questions, learn more about all the things that they're doing. All right. A big question is, how is the opioid settlement dollars, how should it be allocated across this? Remember, we have this 1.1. If you add this our interest income, it kind of can range between 1.2, $1.3 million a year. And so as we have surveyed both county staff, community staff, healthcare providers, academics, this is kind of the approach. So far we have a balanced approach around 50-50. This is what the survey results a bit the allocation for how the opioid use fund should be split. Now, remind you, we are working with this $1.1 million per year. And then the second number 2 that came in was mostly community-based programs. And then number 3 was mostly county-led programs. So this is how this looks. And in terms of community priorities for future opioid settlement investments, we asked the question, just pick your top 3 prioritize moving forward. You had a choice of 11 in this survey, and the reason why we had 11 is because those are the only 11 that we can actually spend these funds on, as they are restricted funds, and they can only be utilized for 11 eligible evidence-based strategies. Those strategies span across prevention, treatment, and also recovery efforts. This is just some survey results. These are areas that we have shown so far, which is recovery housing. Number 2 is in addiction treatment. And then number 3, is peer support and also recovery support services. I think that may be all I have. All right. Is there any questions in regards to the funding payment schedule, allocations, any thoughts, any questions around that? You got questions? Okay.
All right, this is one we received online. It says Family Court Drug Treatment Court was approved for funding, then without warning, that funding was revoked. How did that happen, and what was the process?
Sure. Yeah, I think that the question was more so around the family treatment court, the funding, and why was that funding pulled back? I think we can defer and wait for that for the opioid settlement advisory committee. We can let them answer that. Okay. Yeah. Yeah. So that no, you can hold that. We'll get to that question. We'll hold that one. So we'll have the opioid settlement advisory committee. They'll answer that question for you. Yes. All right. Any other questions, Sue, in this regard? No.
On the work session, someone asked about early intervention, and you said your response was, yes, we can do something like that. However, early intervention was stricken from the items that were selected, and also Together for Resilient Youth was approved for a small amount of settlement funds, but I noticed that the only ones that you mentioned are the county programs. So those are my questions.
Absolutely. So those are the survey results did show for early intervention as those were of high interest across the community. When we get to the OSAC recommendations, once again, I can defer that to them to see what does that look like. That makes sense? Yep. There's two county programs and one community-based program here, which is going to be Recovery Innovation, which they all can come and join us now. And you're more than glad um, to ask them any questions as we move forward. So yes, but these are for the FY. So right now, what we do is we'll move into the panel discussion, and I'll have Miss Lakeisha Farmer. She's going to help facilitate this session here. We have not got to the FY27 recommendations yet, but that'll be the one after this. So I'm going to turn this over to Ms. Farmer, and she will help facilitate the session.
Thank you so much. Good evening. As Jason said, my name is Lakeisha Farmer. I'm actually a county employee. I work in Durham County Library. I'm based at the main library, but I'm here as a participant in Durham County's facilitation network. So we have a group of county employees who facilitate meetings for county departments as well as community events, and that's how I happen to be here today. We're going to take a few minutes to have each person on the panel introduce themselves and their organization, and then we'll get into our discussion. And we will come back to your question, so it is not, it will get answered. Okay, I just wanted to make sure it will get answered. Yes, both, because there are two parts to the panel discussion, so both of your questions are more geared towards our second panel. So this is our first half with people who have received funding, groups that have received funding, and then there's the advisory committee that helps make some of the decisions related to funding. And so we're going to table those questions until they're the panel. You're welcome. So if we could start here, and if you could introduce yourself and tell us about your organization.
How's that? Beautiful. Okay. Good evening, everybody. I see a lot of friendly faces. So everybody I know, hello. I'm so glad you're here. Everyone who doesn't know me, my name is Morgan Culver. I work for the Durham County Public Health, and I am a harm reduction coordinator. Wow. First. How's that? Whoa. I can be quite loud without a microphone, so this is hopefully even better. Okay, I'm going to start over. My name is Morgan Culver. I am the harm reduction coordinator at Durham County Department of Public Health, and I manage our harm reduction projects. For anyone who doesn't know, harm reduction is an umbrella term that describes a whole bunch of evidence-based public health interventions that mitigate the negative outcomes associated with drug use, reducing overdose, injury and death, reducing infectious disease transmission, injury, infection, all of that stuff falls under harm reduction. And our program has has three main components. The first of which is naloxone distribution. Naloxone is also called Narcan. You all might have heard it called that. It's a fantastic, incredible medication that saves lives. It reverses opioid overdoses and prevents opioid overdose death. So we have a huge naloxone distribution program. That's one of the strategies that we receive these funds for, is naloxone distribution, like Jason said. The next component of our program is our Safe Syringe program, which is a syringe exchange program. You might have heard it called that. And that's the second strategy that we receive these funds for. Our syringe exchange program operates through a whole bunch of channels. We have walk-in service at the health department right up the street. We also do deliveries. We do outreach at events. We do outreach at encampments, street outreach events, all kinds of stuff like that. And then the third piece of our program is harm reduction education. So that's educational materials that we create and give to community members. It's one-on-one harm reduction education we do with participants of our programs and community members on how they can use drugs in a safer way, prevent disease and death, stuff like that. And we also do a lot of trainings. We offer free harm reduction training to any interested organization in Durham County. Yeah, which button? It's going to be on the right. It'll turn green.
Okay. Hey, good evening. My name is Jason Abrig. I'm with Durham County EMS Community Paramedics. I'm a community paramedic, like I said. So our ultimate implementation of the opioid settlement funding is to support post-overdose response teams that connect persons who have experienced a near fatal drug overdose to addiction treatment, recovery support, harm reduction services, primary health care, or other services or supports they may need to improve their health or well-being. I'm pretty clear cut and dry.
All right. Can you hear me? Yeah. Hi, all. I'm Kim Chanson, and I work as one of the community organizations. I work for Recovery Innovations. I'm a peer support specialist, and I supervise the Community Linkages to Care program. And what we were designed to do is to be able to go out and meet people where they're at, what they're at the highest risk of for overdose. So we have liaisons with the hospital, whether it's the ED or people who are in a longer-term hospitalization related to opioid use. We work with the community paramedics, we work with harm reduction, we work with the detention center to just be able to immediately go out and not have to jump through the hoops of like billing Medicaid and getting authorizations and all that kind of thing, but instead use our lived experience and our certification training to be able to immediately go out and respond to those people who are sort of the highest risk and unlikely to stay engaged if someone doesn't come to them quickly. So that's what we do.
Thank you all for that. As you shared what you're doing, how you're using this funding, are there any accomplishments that you're each proud of that you've been able to do this year because of that funding?
Am I back on? Beautiful. Okay. I love this question. I love to brag about our program every chance that I get. And so a formal opportunity to do so is very exciting. For our naloxone program and for our Safe Syringe program, we've had a bunch of huge accomplishments in the last fiscal year. So since about a year ago from now. Last year, I think our total number of naloxone kits we distributed was in the ballpark of like 4,500 or 5,000. And already this year, we've distributed 7,500 naloxone kits, which is a huge accomplishment for us. There's lots of data that shows us that communities that have a higher saturation of naloxone in the community have fewer overdose deaths and they have less drug use overall. So we're super proud of just the number of these kits of life-saving medication that we've gotten out there. A big part of that accomplishment has come in the form of our two beautiful new free naloxone vending machines that we have. We already had two of these before this year, but with these funds, we were able to get two more, and they are both placed at community locations. Dr. Morse is here. They have been a wonderful partner to us. So one of our new beautiful free naloxone vending machines is at the Morse Clinic in North Durham off of North Roxborough. And then our other machine is at St. Joseph's Episcopal Church, which is way down this way on Main Street, like behind Whole Foods. And so those are two places that we have now that where anyone can show up 24/7 and get as many free kits of naloxone as they want. They don't have to talk to anybody. They don't have to pay anything. They don't have to give any information. And so having those has moved a lot more kits, and we're really proud of it. It was a lot of work to get it set up. Another big thing we're proud of with our naloxone is how much of our naloxone is given out through our community partners. So I just double checked before this meeting, and about half of the naloxone we give out is given directly to our community partners. We have almost 50. I was hoping I'd get 50 by today. We have 49 community partners that we give naloxone to for them to distribute to participants of their program or patrons of their business. We have LGBT Center, we have a bunch of nonprofits, we have clinics, we have barbershops. Really anywhere that people who are at risk of overdose go is a great opportunity for us to work with folks. And then for our Safe Syringe program, the thing that we're really proud of this year is our program has had a huge expansion, mostly due to our partnership with the City of Durham's HEART program. And we have made it so that they are able to provide syringe exchange services out in the community under the umbrella of our program. And since we've done that, we have drastically increased the amount of services that we've been able to deliver. So we give out way more syringes, we collect way more used syringes from the community, we give out a lot more naloxone, we see a lot more people who live further out and don't have transportation and have no way to see us. And so that's been a really big accomplishment for us.
Before we move on, I also want to share that we do have Narcan kits in the library, in all of our libraries as well. So we have those available. We have staff that have been trained, so we are able to administer it in the library and have it available in the library as well.
Yes, in your like emergency AED boxes,
Yeah,
right?
we keep them in our AEDs so that everybody knows where to find them. The
Yeah.
AEDs are centrally located. You have a question?
If I'm reading the slides correctly, you are receiving $750,000 to arguably continue, that allow people to continue to use drugs and not offering any treatment alternatives.
Thanks for this question. This is a great question, and this is a question I get really often. So there is no evidence that suggests that doing harm reduction services increases drug use or causes people to continue to use drugs longer. The purpose of our program is to give people tools and information to keep themselves alive and prevent transmission of things like HIV and hepatitis C. And we do also offer people connection to treatment if that's something that they are interested in. Thanks for that question. Sorry? Okay.
And ma'am, we will make note of that question, and if it's not addressed fully by the end of tonight, we will make sure to get your information and be able to have some more discussion about that. But thank you so much for sharing that. Yes. Yes. I'm sure Jason said somebody would come with the microphone, but he didn't say me.
It was you.
Thank you. I am an advocate of Narcan distribution, and it is why my son is still alive. But my question is, can you track usage? I mean, it's a very large number distributed, but I'm really curious if we can look at, or we can figure out a way of tracking who's actually, not who, but where is it being distributed, where it's actually being deployed? Because that's what's critical, not how much is out there to me, but if it's used when it needs to be used.
Yeah, that's a fantastic question. And you reminded me of something I wanted to mention and didn't, so I really appreciate that. Tracking the number of successful overdose reversals is notoriously really difficult. A lot of programs don't even try to track it because it's just not something that people are usually able or like willing to report. But this is something we've had a huge improvement on this year. For this fiscal year, we've had 95 people report that they successfully reversed an overdose with naloxone that they got from our program, which is a gigantic accomplishment to me. That's like 95 people like your son who we still have with us thanks to this. And additionally, I don't have it with me now, but we do keep track of the zip code organization. I have all that information on where all of these kits go. And we try really hard to, all of the partners that we work with and all of the places that we go do street outreach, those are in priority areas where there's a high burden of opioid overdose. So we try to be as strategic as we can. Thank you for that question and for sharing. Yes. I'll say it. I'll talk the whole time. Mhm.
At two parts, is your budget a public record? Because I know that Durham County and especially North Carolina allegedly prides itself on being very transparent with the funds. And I was wondering if each three of y'all who have received, I guess, the $1 million have your budgets public and it shows exactly where the funds are. And part two is, do you have a system with people who actually anonymously pick up these kits or family or to use to save their lives? Presumably that they tell you that they used it, that you're able to track these 4,500 kits that you've distributed to say, I mean, is this evidence-based that they're being used to save lives and the lives? How do these people, this particular population, informs you that they used it successfully? So it's a two-part.
Sure, I'll answer the second question, then you can jump back to the first. That's a great question. So whenever we see our participants who come in for our syringe exchange, one of the questions we ask them every time is, have you used naloxone in the last 2 weeks? So that's a way that we get reports through those regular visits that we see with our folks. And then additionally, our community partners who distribute in the community, if they hear from participants or they do it themselves. We just had one of our partners reach out and say that they saw someone overdosing at the Shell on Main Street and used it, and they just sent me an email. So this is part of why it's really difficult for programs to track this number, but we do get them through those two avenues.
Excellent. I'm going to answer your second part, and then I'm going to allow this lady some others to ask some questions as well. The second part of it is, yes, we are mandated to submit our spending authorizations. It actually gets approved first, and then after we utilize those funds, they are monitored by the state as well. And then we also will submit that the approved authorization, and it's on the Core NC website. So it is publicly seen, and you can actually see all of the spending that's happening across every single county in North Carolina on the website.
Hi, my name is Nancy Gordon. I came here because I am a retired emergency judge who used to run the family court, drug treatment court in Durham. And I guarantee you, we had statistics about our success also. I am really angry to learn that this money has already been allocated or allocated subject to going to the county commission. I don't even see, I see one commissioner here. If I'm missing, there's another. I can't tell you how angry I am that I took my time to come down here to hear what I'm hearing is an explanation and justification for how we plan to spend this money. And frankly, the fact that drug treatment court, you want to stand up, all the court people? These are the people that took their personal time to come down here from the court. They have been involved. We're trying to keep children in families, not stop people who as adults have made choices about their lives that are crappy choices, but to keep children with their parents. And the biggest reason that families come into abuse, neglect, dependency court in Durham County, and I have been doing this since 2007, is mental health, substance abuse, and poverty. Shame on you all. Thank you.
We're going to take one more question, and then we're going to continue with the panel.
It's not really a question, and definitely, Jason, let me know if I'm speaking out of turn. I think the slide is a little bit maybe confusing because it's listing like recipients as if these are the only people who receive some of this funding. I know of at least, our program and Lincoln, which are both treatment programs. We run a mobile clinic and street medicine program in Durham that has received some of this funding as well. We do Suboxone initiation and maintenance in the field. We have done over 100 intakes and have over 50% retention. I'm happy to talk after. I'm not, obviously going to take over this discussion with details, but if anyone wants to come talk to me about those treatment programs, there might be some Lincoln folks in here who also got a sizable piece of the funding. So just to kind of put that out there, that there are treatment programs that are being funded by this year's funding.
Yep. And just to clarify, these fundings are for the Durham County Opioid Settlement Funds, and I believe you guys are funded by the City of Durham Opioid Funds.
And I'm saying this is funding that has already occurred. So there is, and I know the judge had to leave, but there is funding that has been proposed for the next fiscal year, and we do not yet have a decision about that funding. So I want people to just keep in mind that this is, again, as Jason said, representation of funding from the Durham County portion of the settlement. There's other funding from the city, but that this is not to say this is that represents the groups who will only be the ones receiving funding. So as we go into our second panel, there'll also be opportunities to engage with the group that helps to make the funding decisions. So I just want everyone to keep that in mind. Is your question related to this, or can we come back to it? Okay, because I do want to give the panel an opportunity to continue. And this really will be our last question for a minute.
Thank you. So my name is Gina Upchurch. I'm with a program called Senior Pharmacists. We help older adults with limited incomes pay for medicines, manage medicines, Medicare counseling, tailor referral. We help with Suboxone payment for people that have Medicare. We distribute Narcan. Thank you, Health Department. We're one of your distributors. My question is, I've been here long enough to remember the Health Trust Fund when we had the merger of some hospitals. And we said, this money is going to make Durham so healthy. We're going to do new and creative stuff. And basically, a lot of that money is now going into general budget of the county to support health things. It's all health related, but it wasn't new and different. So my question around this funding is, and I have had nothing to do with it. I'm glad to be invited here. And thank you all for your work to do this. Is it filling in money that was already allocated in these ways, or is it new and expanded funding for these efforts? I just don't want to supplant the general fund. We need more tax revenue from a lot of nonprofits around Durham that should be supporting health in other ways. But that's a whole nother meeting.
Thank you. Are you wanting to answer that now or come back to it? Okay, so we will come back to that question, Ms. Upchurch. Accomplishments that you have been able to, things you have been able to accomplish with the funding that you have received.
Yeah, so I mean there are many, but a couple that stand out is a notable trend in the decline in the number of monthly opioid related calls requiring our response, which suggests that our efforts, as well as other efforts of getting Narcan out, are causing a reduction in the opioid related incidents within the community. Also, we have a very diverse population of referral sources. And so we get like the justice services, friends and family of people that we've taken care of in the past, that send other people to us. And so we're showing, that we have the community's trust, that we're going out, we're making very good relationships with everybody, and forming this trusting bond that makes people comfortable enough to come back to us in their time of need. So
accomplishments. So this was a really interesting year for the CLC program. As any of you who work in community mental health know, that we're seeing agencies and programs shutting down right and left as there's funding cuts happening. And so we had a sister program at Recovery Innovations. We had a treatment program that was specifically opened to provide MOUD, medications for opioid use. And they actually were shut down due to funding cuts last last year. And we were very grateful that CLC happened to be a sister program, and we were able to help over 100 people transition to other programs so that they didn't just fall through the cracks and get lost. And many of them are still working with CLC in addition to being securely connected with a new treatment provider. So we're really happy that we were in a position to be able to offer that. And then with that transition where we didn't have a clinic on site anymore, that opened up staff time for us to find some new partnerships. And one of the things that we just started in January is we're partnering with the STAR program at the detention center. And so we're able to go in and offer wellness classes there, and then so that they have that connection with a peer support specialist before release. And so when people get out, we're already in their lives. They already feel safe and trust us, and we have that connection and are able to intervene ahead of time, helping them find safe housing and have things set up for when they're released and they know that they have someone to come to. So we actually, for the first 6 months, we've been doing it virtually. And today was our first day that we went into the detention center to be able to facilitate the class. So that was really awesome. Thank you.
Thank you so much. I'm thinking, because I already let you talk. No, I said I already let you ask your questions, no. But can I ask, is this a question related to the accomplishments? Can I come back to you for the question? Will you remember the question? I'll come back to you, because there was another question over here as well, so I will come back to you. You talked about accomplishments. Are there barriers that prevent you from providing the service that you need to provide? What are some of those barriers?
I'll go first. So there are barriers both on like our end, and then even more cumbersome barriers on the end of the people who are recipients of our services. So I think on our end, barriers are just like we don't have enough capacity to meet the demand that exists in Durham. We're very lucky, and there are a bunch of organizations that that their work overlaps with ours, just like these folks up here. We're very lucky to have the North Carolina Harm Reduction Coalition here in Durham. They've been doing this work for almost 20 years, and still we are not able to meet the demand. And then I think on the end of our participants of our syringe exchange, people who receive naloxone and training and all that stuff from us, the barrier for them to access both our services and services in general, I think is really is stigma. It's still, we've heard some stigmatizing language here in the last 20 minutes, right? And everybody gets to have their personal feelings. This affects people. These are real issues. And stigma prevents people from trying to access care. It prevents them from seeking these services. So that's a big one. And then another big thing is just people's basic needs are not being met. People are not housed. We have participants who every time they come get syringes, they ask where they can get food. And without being housed and fed, trying to get into treatment or any other medical or social services is extraordinarily difficult, if not impossible.
So yeah, I'll go along with what Morgan said. We have a large population who transportation is a real big barrier for them to get to their doctor's appointments, to get to counseling sessions, and different things like that. We also have the barrier of recovery-friendly housing. We have some issues with people who we do get into medication for opioid use disorder, and these housing facilities won't let them have that medication in there, which then they have to choose between their recovery and housing. So that does cause a little bit of a barrier there. And as Morgan said, capacity, we're not able to keep up with the demand as well. I mean, we're trying, we're doing our best, but to have some more help would be great. But yeah, so those would probably be the biggest two.
I'm gonna say the same similar things. I mean, because we're out there doing it. So this is what we're seeing. And you guys are seeing that. There's the lack of housing and affordable housing and safe housing, transportation issues. One thing that I've loved about CLC is because we can go out and help drive people, or even we have some funds for Ubers, and that has really increased the number of people who are actually attending appointments and engaging in their treatment appointments. But one of the biggest things that we see is just the chaos of everyday life that prevents people from being able to engage in their recovery. You know, they have every intention of making an appointment with us or an appointment with their PO or an appointment anywhere, child legal services or whatever. And then something happens. You know, constantly we're getting can somebody give me a ride? The person who was supposed to drive me to the methadone clinic is drunk and can't drive. Or, you know, so and so, there's just unreliable, and there's just that chaos of everyday life. And so for us, just walking with someone, trying to do what we can to help mitigate that and take the edge off that, so that, and also because we're funded by the opioid settlement rather than trying to bill Medicaid and meet the service definitions and all of that, we're able to be patient with people. Like a lot of agencies I've worked at, if someone misses repeated appointments, they're just discharged. Like you can't sustain a program if you have to bill Medicaid and people aren't making their appointments. And by us being supported by these funds, we're able to be continuing to be there for people as they are navigating, especially the chaos of early recovery.
Thank you. We are going to shift. I think you had a question before. I think it was you that had a question. Was it? I knew there was a question on this side of the room, and I didn't forget you. Someone had their hand raised when Ms. Upchurch was speaking. Okay, so if you would.
Tiny question. I'm a math geek. Okay, so how many doses of Narcan did the county of Durham receive for the last fiscal year? How many? I'm not asking how many were distributed, how many were used. How many doses were received by the county of Durham? I thought I heard 45 and.
No, so we've distributed 7,500 and we have spent, the slides went by earlier. We've spent, I think, 90% of the funds that we got for that. And I believe, my supervisors in the audience, did we ask for more money? Because we spent all of it on naloxone and gave all of it out last year, I think. He knows more about the money than I
Happy
do.
to follow up, but we didn't receive, we essentially procured naloxone through our contracts, roughly about 5,500, which also didn't meet the need, but we also received naloxone from the state of North Carolina to help meet that need. Yeah, so approximately about 5,500 naloxone kits were procured last fiscal year. This is the harm reduction and safe syringe strategy at Durham County Department of Public Health.
Yeah, like these folks also get naloxone. Lots of other programs buy their own or get it for free. So there is more circulating in the community that didn't come from us. Yeah.
Answers your question. Somewhat.
I'm not sure I understand the question.
Well, she was asking how much naloxone the county as a whole received. And then you only know what you received, then OES received. So it's hard to say, but then we can follow up on the question of how it was funded is another question that we probably cannot answer in this moment.
I'm sorry. No, but thank you. This is my third opioid settlement fund meeting, 3 in a row. And I've seen all three of y'all at each of the meetings, and I've heard, if it's not you, your teams discuss what you do. And my question is, how, because this has been, the funds have been in existence since 2022. Have y'all historically been funded from the opioid settlement funds like the previous fiscal year? This is fiscal year 26, I believe. Were you funded in 25 and in 24 and in 23? I guess 24, 20. Yeah, 24 was my first one, and I heard you speak.
I didn't work here then, so maybe you're confused with someone else, but
and let me apologize, I
Sure.
didn't phrase that correctly. Your offices.
Okay.
Representatives.
Sure.
Your departments, your teams, if you will.
Sure. I can only answer for our program. We have received funds for the safe syringe program strategy and the naloxone strategy for fiscal year 26 and fiscal year 25. So this is the end of our second year receiving these funds.
And if I could go down, and you, sir, your
So I don't want to mislead you. Our program manager had a previous engagement. Lee, do you have anything on that?
But the kits we distribute do not come from opioid settlement funds. We actually have separate federal grant dollars that came through the state, pay for us to have naloxone kits distributed to the public and also from the fire. So all of the fire. And to understand where all that funding goes, we buy a lot of naloxone in EMS, but we buy a portion of it to use on people that all kinds of money need naloxone. That's entirely separate. That's part of our regular county budget, medical supplies. It's not grant funded, it's not opioid settlement funds, it's just our day-to-day operating. But the opioid settlement funds for us don't provide marketing, but they do provide people. So that's been the biggest thing for emergency medical services. We had 2 community paramedics. Now understand that in Durham, we run over 60,000 emergency medical calls a year. And we only have 2 community paramedics to go out and try to follow up on people after they overdose and hopefully give those people more help. The opioid settlement funds allow us to add 2 additional community paramedic positions. So Jason's position is funded completely from opioid settlement funds, and that doubles our community paramedic function, but also that has dramatically increased our post overdose response. So we're able to, after our 911 crew revives someone with naloxone in the next 24 hours, hopefully one of our community paramedics as part of post overdose response will get to them, and then the goal is to enroll them in MOUD, medication program support. But the point is, we can start that in the field. So the paramedics can start giving buprenorphine to get these people on the road to recovery, and we can continue to go back and see them and provide that buprenorphine for up to 7 days, sometimes more, until they can get into a program like treatment or horse clinic or somewhere they get an office-based treatment. And I think more to understand about that, buprenorphine and the positions, that is funded for the settlement. But I can tell you, having been working the streets of Durham for a long time, what we used to do is just provide people after a heroin overdose, and they would leave and see you get harm. Now we actually have something else we can do for them. Because even in the past, we couldn't go to the hospital. There's nothing the ER was going to do for you. Now, both us and the emergency department can bring people into office-based opioid use disorder treatment. That is a step. So we're able to get these people, and I think that's what the primary thing that Jason in his position, funded by these opioid settlement monies and the other community paramedics follow. The biggest thing they do is get these people into ongoing treatment that will eventually allow them to recover.
Thank you so much.
Sure.
And the question actually was, how long have y'all been receiving the
So I guess last fiscal year is when we created these positions. That's the first opioid settlement funds that came to emergency medical services would have been the beginning of last fiscal.
That was in 25.
Yes, July 1st, 25 would be when we started.
Thank you.
Well, that was a lot of coffee just for that. I'm sorry.
I know, but it's okay.
Thanks.
There you go. Thank you.
So for the sake of time, and for the sake of time, we do want to be able to transition to the other panel, but we do have a couple of questions online that we'd like to address as well. If you can quickly tell us how long you've been receiving these funds.
I joined CLC midway through. I think it's been open since like 2020, and it was on a previous grant. And I think we've had opioid settlement funds for 2 years, I believe.
Thank you. If we could address some of the questions online.
Awesome. We have a couple questions that we have online, and then we'll switch out into our next panel just so we can stay on time. There is a question about, do you have data that demonstrates or supports your impact on overdose rates in communities in Durham? I'll throw that out there. Let me know if you want to take that question. And there's a couple other different questions too around just that. There are a lot of claims that are being made, or is there data available to support these accomplishments and is the data public?
We have a lot of data about our program that I am happy to share with people if they're curious. And I don't know, Jason, if you want to mention the dashboard also.
Yeah, we do have a public facing dashboard that that's updated every quarter. And so it does kind of show a lot of the distribution, all the impact that we're doing. And once again, that is public facing. So you are able to openly see the work that's being done very consistently. All right. I think that some of the other questions actually move more towards the Opioid Settlement Advisory Committee. So we'll close this out.
So I just want to thank you all for sharing this evening and tackling the questions. I want to ask if you could all just give them a round of applause to thank them for participating today. We're going to invite our second group up. And I said give them a round of applause, but also give yourselves a round of applause for the work that you do for the community, because you also are important and what you do is valued. So although we had this group that was highlighted this time, and obviously some other times as well, I don't want it to seem as if these are the only people doing the work. So we do recognize that this is a community effort, and I hope that we can continue to build the collaboration within this room. Would you like to?
All right, we're going to continue the conversation, and I want to invite Ms. Brittany Price and Ms. Lisa Howard Martinez. They can introduce themselves once they get here, but we are now going to have the Opioid Settlement Advisory Committee, and they will speak around the recommended budget that they have proposed, them and their committee, and they'll talk more through the recommended budget. So we'll start off by first, can you guys please introduce yourselves to everyone?
Good afternoon, everyone. My name is Shalisa Howard Martinez. I'm Executive Director of Aging Well Durham. I'm also the co-chair of the Durham Opioid Settlement Advisory Committee, along with Brittany Price, and I also serve with a couple of other community coalitions here, including co-chair of the Durham Partnership for a Healthy Durham.
Hey y'all, thanks for being here. I'm Brittany Price. I'm also a co-chair of the OSAC, and I occupy the healthcare payer seat, healthcare payer and funder. My day job is in monitoring and evaluation technical assistance for overdose prevention programs nationwide. And as part of that job, I evaluate and help make funding decisions for national level funding for overdose prevention programs.
Excellent. So about 9 months ago, we took on the initiative of developing an opioid settlement advisory committee. And one of the things that we want to do is we want to pull individuals from the community with vast differences in subject matter expertise, bringing them to the table to really advise and bring recommendations around our strategic planning process. And so there's healthcare seats, there's individual law enforcement, there's different seats here, but we do have our co-chairs today. So specifically, I think what people want to hear about and talk about is the FY27 OSAC recommendation. So I'll go ahead and put this slide up here, and then we'll start asking some questions here. So this is the FY27 OSAC recommended budget, and I want to open it up to either Shalisa or Brittany to kind of walk through this recommended budget.
Well, I would say, first of all, this process was a very difficult, challenging one for the committee. This was our first time out, and I think we definitely can improve our process for next year. And in fact, one of our next steps is for next week to have a debrief of how we work together to get to these recommendations, because there was some inconsistency in how we approached this. So for example, there was a small group of folks who first got together used a set of criteria to evaluate all the proposals. And then once they brought back their recommendations to the committee then took on the process of also looking through and developing recommendations at an individual level for the proposals. So that's the first thing. This was I would say, not ideal process for us, but we are committed to improving it. But I would say the first thing, or the most common sentiment that we received from committee members about their funding recommendations was the concern around continuity of current funding, or the current grantees, making sure that those programs were continuing to receive support. And also there were recommendations around other funding proposals that were submitted this year that they should be supported through actually the general fund, through the Durham County General Fund, and not necessarily through the opioid settlement dollars. I don't know, Brittany, if you want to walk through the process. She was really the person who put together, help us get back on track to get to this point. But if we have specific questions about any of the recommendations that you see in front of you, we're also here to take your questions. Mm-hmm.
Sure.
Yes. Thank you.
Mm-hmm.
My name is Catherine Constantino, and I'm an assistant public defender specializing in the representation of parents whose children are taken from them. 85% of my caseload in Durham County is substance dependence. You heard one of our previous family court drug treatment court judges here openly and very clearly state her position. We worked, and many of my team members are here tonight, worked tirelessly for almost a year. As you heard me say earlier, this is my third settlement meeting. And we submitted, we did everything we were supposed to do, as I'm sure many people did.
Yes.
Everything. I can only speak to my magnificent team.
Right.
Okay. And there is no federal money, by the way.
Yeah.
For certain reasons I voted, but oh well.
Yeah.
It is what it is. There is no federal money. We've checked. I had magnificent people, lawyers and organizers on our team. We drafted it and we received a recommendation. Okay. We received a certain amount of money, and it wasn't all that we had asked for. I am in receipt of an email from your team, your team or the team that was going to give us a recommendation. And then suddenly, without notice, I was pulled into an office and told that there was a second vote. It was very off-putting, you can imagine. Nefarious, bizarre, amateurish, that there would be, I pick up another word, this kind of a vote, and that the money was taken from us, meaning the recommendation was off the table. And there was, through rumor and speculation, that this was because of this general fund, and that we should not be asking for opioid settlement money. And I don't really know what any of that means. But first, I'd like to understand why we were recommended, or there were recommendations that may have been made to other people. And then all of a sudden, a second vote occurred. I just think that's such a bad look.
I agree. I agree. Oh, you go ahead.
Oh, yeah, it is definitely a bad look.
Okay, what happened?
Okay, so I will take you back to December of last year.
Yes.
The RFP was put out.
Yes.
The Opioid Settlement Advisory Committee was informed by Jason that the RFP was out.
Yes.
The RFP had been designed by staff. The rubric had been designed by staff. In January, our impression as a result of our January meeting was that the Opioid Settlement Advisory Committee was not going to be part of evaluation of these applications, that was going to be a smaller group made up of staff and 2 to 3 committee members. We were invited by staff to register our interest in being part of that committee, and 3 of the 4 people who responded were put on that small group. So that group went through it with, and again, it was 3 committee members and 3 county staff, 4?
2 counties.
2 county staff, thank you. 2 county staff.
That is the public defender of Durham County.
Yeah.
Yes, and she's a exact member.
Committee.
Yeah, she appropriately did ethically what she needed to do when our grant.
Absolutely.
That's right, that's right.
Absolutely. Mhm. And then we had moved forward with a plan for pursuing a collaborative strategic planning plan, which is what we were under the impression that our role was. We were under the impression that our role was not to be involved with the RFP. Then in in March, we received an update from staff that gave kind of the general buckets of recommendations. So I think it was like about a third for harm reduction. I don't remember the exact percentages off the top of my head. Some set aside for naloxone. It was like the general buckets. Then in April, we were asked to vote to approve a recommendation that included scores from the small group as well as these amounts that I'm imagining are the ones that you were emailed about in March, maybe?
Yes, our application was due the end of March.
Oh,
So
okay.
we submitted it perfectly. You know,
Okay,
in
great.
advance, in fact.
Yeah.
In advance of the deadline.
Great. That's also news to me. I thought that all the applications were
We're due at the end of January.
In January.
Yeah.
We did it in advance. I just want
Okay.
Oh, no, yeah.
with evidence and statistics.
So we, as a committee, this was like, we had a lot of questions, as you might imagine, because it was news to us that we were part of reviewing these part of making these recommendations now, when the rest of the committee had not been part of this assessment process. We also had questions about the origins of the numbers that were recommended. We asked, there was also in that suggested recommendation, this, I guess, goal of splitting $1.5 million between community-based organizations and county programs. We had questions about where that came from because we didn't know. Some of the members of the small group from the committee did not participate in coming up with these numbers. I think that some did, but there were some who said, I don't know where those numbers came from.
Are you referring to budgetary numbers?
Yeah, the recommended funding and
The funding numbers. So we all said, well, not everyone, many of us, including myself. Yeah, not everyone. I will say, not everyone. Many committee members, including myself, were very reticent to vote to approve a recommendation that we had not been part of making, because we were told that we weren't going to be part of making it. So there was also some concern about, as Shalisa mentioned, like sustaining established systems under county programs. And there were a lot of questions about, again, like where these suggested numbers came from. So that's when we really pivoted.
Yeah.
Yeah.
And the committee had a month-long deliberation at once a week going through the applications. And again, we didn't use the standardized process that the working group did.
Right.
That was that small group.
Right.
Of 5 folks.
We
yes.
did. We did have.
It's so, and I'm sorry, I felt like here asked a very valid question early on. That, and my questions were very strategic to understand. Because we were recommended and then we're not. And you can imagine.
Yeah,
I'm sure.
How that is. Maybe you can, maybe you can't. But this nice person behind me said what a lot of us are thinking. all three of these recommendations, or all of the recommendations that are made, are all county organizations,
Right.
teams,
Mhm.
and they historically have received funds prior to the institution of the RFP and this voting and this process. Again, it's not a good look, at least from my perspective. Now, granted, I'm biased because I worked a year and I'm in the system and I represent substance dependent people who have so many needs, but in the meantime, their children have been taken from them.
Absolutely.
And that's
May I-
where we are. So I just, I don't understand.
So something else to note is that historically, for example, the harm reduction program and the CLC program and the post overdose response team were funded by opioid settlement funds. Our current recommendation splits recommended funding about 60-40 between county and community-based organizations. It's about 50-50 if you take out strategy one, which is collaborative strategic planning, which is this meeting, Jason's position. Something that is important for me to note here is that our understanding, and we have a few commissioners in the room, is that the family treatment court will be funded by the general fund. And that is something that.
So let me pause there. Thank you. You use that term again, this general fund, because it's wildly discussed that the county, our county is strapped for money. We expect no money from the county. There is no money. That's the world we live in. So in a way, I feel that is disingenuous if this general fund, the reason why there was we can use all the pretty words, and words have power. We know this about counting and recounting and giving and taking and not voting. And we weren't supposed to be a part of the vote. I'm not diminishing your concerns, voting and not voting. But if a basis of re-voting was that there is the existence of a general fund that is funded by the county, that to me as a citizen and a taxpayer of Durham County for many, many years is very disingenuous when I read the paper and I hear the news and I see the budget and we don't have any money. And the county itself has been hit with some very large settlements for some very big challenges throughout the year. So is this where this general fund is coming from? And is that the basis for us being unrecommended?
No, that's not the basis for y'all being, well, I think there was consideration that the county would be funding the treatment court. But there was I think Commissioner Jacobs here wants to talk about that. But I will say that one of the things that has most disappointed me about this entire process was that it was not a transparent process when you're looking at it from the outside. As a community member, I've lived in Durham now more than 30-something years. And as a community member, if I was sitting and watching this, I would be very concerned about what was happening within these committee meetings, even though we're live on YouTube and all of that. It is concerning, but
Well, Chief Defender Baxton could respond. We did discuss during one of our budget work sessions, Chief Defender Baxton came, as well as our DSS director, and we know that also there was and also our Justice Service Director, Roshana Parker. We also know there was collaboration with the district attorney and District Court Judge Montgomery Blinn. And I can tell you that there was unanimous support on the Board of County Commissioners and for the family court. And the county manager told us at that budget work session that she had found the funding for that, that it was a priority. So it is in the proposed budget that we will be voting on next week.
Okay, good afternoon. My name is Dawn Bax, and I'm the Chief Public Defender here in Durham County. It's just a couple of things I want to clarify for the community. I'm a part of this opioid settlement committee, but I'm not up here. I was a lone wolf because I was part of that small group that was given the task of working with 2 county employees to look at the applications for funding to go to these community programs. We were given the task of looking at the applications and deciding which ones best fit the strategic plans and the evidence-based strategies. And we did that because we were told that there was a suggestion that 50% of this money go to the county, 50% to the community. I think we should honor that. So the small group did come back with a recommendation of a lot of community groups and not county groups. And when it was presented to the big group, that is when it got hijacked, and it was like, we can't risk hurting these county programs. But I need you to look at the amount of money that has gone to these county programs. And I would hate for Durham County to look back and see that we had all this money to fix or try to tackle this opioid crisis, and the best that we could do was continue to fund millions of dollars in county programs for naloxone and syringes. Now, I know that sounds simple, but there's more to fixing this problem than naloxone and syringes. And so you as citizens need to be mindful of that. You need to fight for that. And it's not just about the drug treatment court. It's about a lot of county programs in the community that we need to get funding to so they can assist us in fighting this problem.
But it goes back.
We're gonna get over here for one more question. We're about 5 minutes in.
Thank you. So my name is Jennifer Carroll. I'm a researcher, and I understand the frustration with having grant applications not funded. I had like 3 not funded this year, so I feel this very deeply. A couple of things. So I think that my suspicion is that the way that we're talking about when we say recommendations, I think we're not all talking about the same thing, and that the process has changed over time. I'm aware of other community organizations that were told essentially that they were being awarded a certain amount of money before the committee voted, before the county commissioners voted. And I would like to suggest that part of this frustration is stemming with communication from the county, not with your understanding or your action or anybody else's actions, but like, I think that this has been a very, very confusing process. To that end, my question for the 2 chairs, first of all, thank you for all of the work that you have been doing. I was thrilled when I learned that you 2 had volunteered your work as chair. I may be wrong. I have been wrong before, I'll be wrong again, but my understanding is that currently when we are looking at these, like what should be funded right now, asking that broad question, that we are limited to list A on Exhibit E of the global opioid settlement. If folks want to Google it, it's very easy to Google opioid settlement Exhibit E. There's a list A of approved activities and list B of approved activities. I could be wrong. I am not a lawyer. My understanding is that programs like the drug treatment court, unless money was specifically going to like buying naloxone or paying for medications or something, let's say, is actually not eligible for funds until the county does the larger community planning and unlocks the B list items. And I'm curious if that is correct per the understanding of folks in the room.
That would be a question, a wonderful question to ask Jason, but yeah, Jason, do you?
Yeah, it is currently eligible under the, I think it's strategy number 11, which is the criminal justice diversion programs. It
Yeah.
falls underneath for there. And I can get you some clear
Yeah.
specification around that. So, and one of the things that we do when we do get our proposal, we actually run it through OSTAT, and they actually have to vet every last one of our activities before it even goes to the commissioners. We make sure that it's vetted for eligibility beforehand. And that's just not. Okay. I'm more than glad to show you, but yes, we can talk afterwards.
Yeah,
afterwards.
we'll figure that out.
No problem.
But I will say, like, I think also besides the process, which was, again, not the best, not something that I'm personally proud of as a Durham community member. The other thing, besides the concern from the committee members about continuing funding for the existing programs or for the programs that received funding last year, another thing I think was just also the concern about responding to the immediate crisis that we have in the community, and that's why there is so much focus on naloxone distribution, the syringes, the syringe service program, and the post-overdose response team. Over the next year, we have got to be committed to learning more about the entire continuum of services and programs that we need in our community in order to use this funding more effectively. So, for example, early intervention. What are things that we can be doing to support youth and families who are at risk of substance use disorder, of overdose? Who are the community members who are currently supporting those families, those community members? What is happening around recovery housing in Durham? That is a huge gap in knowledge, I feel, on our committee. So I think a big part of it is that we are just now stepping into this. And yes, we did not step into it correctly. I'm trying not to say what I wanted to say, but a big part of this is us learning more about how do we broaden the range of continuous services in this community so that community members are not experiencing gaps, no matter where they are as far as this topic.
May I just add, I'm so sorry. I would like to add to Shalisa's point, what we are going off of, because we haven't started or we haven't really undergone the collaborative strategic planning process yet. We haven't had as much time to learn about the current landscape in Durham. When you look at these budget priorities, they align with priority strategies from investment from last year's meeting. Those priority strategies were the ones that were related, extremely important, were naloxone distribution, recovery support services or peer support, the post-overdose response team. And then in terms of which strategies should receive the most funding, the top choices were naloxone distribution and recovery support services, post-overdose response team, and collaborative strategic planning. That is the community input from last year. We also, unfortunately, we know that like the best overdose prevention, the best substance use prevention is housing. As Shalisa mentioned, I do think it's a gap on our committee. It's also a gap in Durham. I was at a Durham Joins Together meeting recently where someone mentioned something that I had suspected, which is that here in Durham, we don't have anywhere for someone to go if they begin using again while living in recovery housing. So they're kicked out and then they're on the streets. And we know that homelessness is a huge risk factor for overdose as well as for increased substance use. That's something that I think we're all really keen to learn more about this year in Durham is what housing is available.
You've only given $61,000 to recovery housing support, and that's to Southlight Health. And again, I guess all of this is explaining why there was a second vote, a change in the recommendations, and the majority of the recommendations, just as our public defender stated, it's not 50-50, it's all county services.
I'm sorry, I don't know.
I don't know if there was a survey last year, because I was here last year, that allocated the percentages of what people wanted to see out of the opioid funds before even anything came out. Again, I was here last year, the year before. I just for the first time saw this survey associated with coming tonight where we could all say, how would you like to see the funds distributed? Most of us, I can say, said 50-50. And according to the percentages that were shown, it was 50-50. But today, and as I think you stated, ma'am, that it is all majority of the funds for this fiscal year have gone to county services?
So the 2620, do you mean I'm so sorry. Do you mean this previous fiscal year that we're coming out of, or this next? This budget? Mhm. Okay, yes.
Did they receive it? So completed its year and
They did. So this represents 60% of this budget. This recommended budget is for county programs. 40% is for community-based programs.
community-based programs there are.
Yes. So there's North Carolina Harm Reduction Coalition, BART, Recovery Innovations, and Southlight.
And also Together for Resilient Youth. Yeah.
Yes.
Together for Resilient Youth, try. Yep. And also, these are just recommendations. As Commissioner Jacobs has just said, there's not been a vote on these recommendations yet. These are recommendations that the committee has presented to the county commissioners.
Okay. One of the things that I wanted to say as Together for Resilient Youth is, first of all, we've been around for 20 years. And many of you don't know that. I don't believe that you looked at the recommendations. Otherwise, you would have seen the work that we have been doing longer in some instances in terms of naloxone distribution, health ambassadors that go along with naloxone distribution, and the kind of care that we take in the community in terms of what we're doing. As a separate part of TRI, we're already doing early intervention. So these are the things that are really, really disturbing. So that when I look at increases for county programs, those increases didn't have to happen. And they could have gone to other programs, including TRI. So, and the opioid epidemic and the way that we address it has shifted in Durham, meaning that there are individuals now who won't go to the emergency department. There are individuals now who are not assisted even by EMS. And if you look at the data that concerns CLC, I'm so thankful for it. But when you look at data that shows that they reached, and this is prior, 450 cases in 5 years, there's something wrong with that. So TRI distributed not with the help of the health department because unfortunately, at some point, they cut off our naloxone kits. And so we get it from the state. Okay, so I'm saying to you that this is so unfair, disrespectful, and you didn't even try to become educated in terms of what people are doing. We don't just address naloxone. We're in the community with individuals like Stan who go out into the community and have conversations about mental health, about health, and providing other support. So when I see, and I was told that I should be happy with $61,395, and I appreciate that, but what we asked for was so much more than that. So am I grateful? I don't know if I can actually say that, because what you're looking at is not what was presented in the application. So.
I would say to the question about when we're going to start learning about this, it starts in August. So we're going to take a break in July. We do the debrief of this process next week. We come back in August. The committee's already developed a learning calendar and priorities. Durham Joins Together is on that list. I think you're the first group in August to be invited in. I will also say that, again, I think the recommendations or the investments that have been recommended this year reflect people's desire to make sure that people are able to stay alive. But we know we cannot to continue only focusing on the on overdose prevention. We have to get to early intervention because of just how the drug market is changing. We need to also work on resiliency in our community. We also need to work on housing in our community. So the whole continuum, we need to improve here in Durham. And so for myself, I know I'm committed to learning more and also figuring out how to support the local groups who are already doing that work well and who are already trusted by community members.
Guys, we are at time. So I just want to first off just say thank you for everyone for all your comments. If you did not get your question asked, there's a ton of questions that are online as well that we still did respond back to as well. And so one of the things that we're planning to do is take all this information. We are planning to package this up along with our survey results, and we will make sure we present a lot of all this information back out to the community. How do you get that information? Please use the QR code to subscribe to our newsletter. It's typically where we put all of our information out. The Opioid Settlement Advisory Committee, they do meet monthly. So we just encourage everyone to stay engaged with our advisory committee, to stay engaged around the happenings and things of that such. So in terms of the budgets, that's for the recommended budget. That'll be going to the board later on this month, and we will see what happens at that particular meeting. I just want to say thank you all for coming out. Thank you all for staying engaged. As you leave out, there is food, delicious, wonderful food waiting for you out there. Box lunches, there is food from 2 different places out there. There are vegan options and also a gluten-free option as well. So please make sure you check the boxes out there. If you are going to eat food, please just sign the food sign-in sheet, which is going to be on your right-hand side.